Hi everyone, my name is Dr. Shirin Towfigh. I'm here to talk to you about how to optimize office flow. As many of you know, I am in solo private practice in Beverly Hills, and that is my only disclosure. With regard to optimizing office flow, today we'll be talking about both patient flow and staff workflow. I will also share with you some COVID-specific tips to help you during this time. The concept of patient flow has to do with mapping the patient journey. It starts with the initial access of the patient to your office and your staff. You can also use data from your own past performance or pretend that you're just a patient and go through the office visit. Once you gather the data, you then go through each data point and try and optimize it. As an example, this is a 15-minute office visit that was scheduled. The patient took 65 minutes to get through the process because there are multiple times of waiting at the check-in, 6 minutes to complete the check-in, 14 minutes to wait in the waiting room. The doctor took 19 minutes for this 15-minute office visits, and so on. And each of these are areas where your patient flow can be optimized. What we call this is patient-centered care as well, because throughout the patient journey, all changes should be made to optimize the patient's needs. I've learned a lot from the concierge doctors that I work with. In Beverly Hills, we have a lot of concierge medical practices, and I use them as my model. They all function in a way that's revolved around the patient, and they're very mindful of the needs of the patients first. Now, as a concierge medical practice, what you're doing may be very expensive. So depending on your practice, there's areas where maybe you can't feasibly bring in those concepts, but do your math. And if you can afford to, or if it's not costly to optimize patient needs, then you should integrate that into your practice, because in the long run, it will pay off for you. Let's talk about some simple things. The phone lines. When someone calls, are they put on hold? How long is the hold time? Are there multiple lines that your office has leading to multiple people? Does the patient have to dial option 1 for scheduling, option 2 for billing? And does that really work? In other words, does it actually go to the right person, or does it all go to one person anyway? Lastly, is your staff returning phone calls within a day? If your phones are not answered and they go to a messaging system, how long does it take for your office staff to return the phone call? So the bottom line is that your patient's needs need to be met, and if they're not met, they will not come back, which will affect your bottom line, or they won't refer patients back to you. Again, that will affect your bottom line. So investing in simple concepts will pay off. In this case, keep the greetings consistent amongst the staff, and that kind of brands you in a very consistent way. And if there are messages that are left or follow-ups that need to be done, use some type of shared system in your office. Maybe your medical records offers that, to make sure that none of these are dropped. In terms of making the appointment, when the patient calls, is your staff warm and helpful? Do they have a standardized set list of initial questions as part of their intake? And how long before the next available appointment? I strongly believe that you should keep your staff happy and feel like they're in a comfortable work environment. That will show in the way that they answer the phone. In my office, we have a standard list of questions. So the patients ask for their date of birth, their insurance information, how they were referred, why they're seeing me. And I see a lot of patients that have had prior surgeries, or it's a complicated situation. They've had a lot of imaging. We make sure that we're aware of that history and whether they've had imaging. And if I can access it, I will. If not, the patient needs to bring it with them the day of the appointment, or we somehow request it to be sent to my office ahead of time. That's super important. With regard to some appointments, there are online automation systems where the patients can go online and make their own appointments with you. In general, the wait time should not be more than 2 weeks. I know doctors that have 6-month waiting times, and that's just no longer a badge of honor. If you have an office where the next available appointment is 6 months from now, you are not running a good office. There's some issue. You either have a wrong system for your calendar, uh, maybe you need more providers for that office. It's just not appropriate to give an appointment out 6 months. It's not a badge of honor. I also want to make sure that you understand that your online presence is very important. So go on Google and Google yourself, see what comes up. Here's our chair of this session, Dr. Laura Doyon. So hers is perfect. You can go to her website, the address is there, the hours, the phone number to the office. You can check your insurance information and even make appointments online. Most people do not have such a good system, so I applaud you very much. But go ahead and claim your business on the on Google and edit it. Okay, let's look at the arrival and view it as a function of your office from the patient's point of view. Was parking easy? Did the patient arrive on time? Is a front desk in an obvious area close to the entrance door? Is your office clean, comfortable, quiet? Is your receptionist warm? So in general, to reduce no-shows or late shows, you should call the patients, your office should call the patients, or there should be an automated reminder system. Also, if you have issues with parking or there's construction around or there's a weird traffic issue to your office, let the patients know ahead of time. They can factor that into their timing of coming to your office so they won't be late. And therefore your patient flow and office flow will be better. Keep an eye on your staff's interaction with the patients. Have an ear to hear how are they talking to the patients, how are they answering the phone, and make sure that you monitor that. On the flip side, I don't like it when the staff is discussing personal information on the phone and the patients in the waiting room can hear it. That should be changed. Your office flow should be switched in a manner that the people that are discussing patient personal information should not be heard by those sitting in the waiting room. And in terms of the COVID times, I have a beautiful office. We have a lot of things that patients can read and flip through. That has all been removed. So make sure you remove all your magazines. We provide hand sanitizers and gloves and masks if the patients would like extra. And if you have a larger office and there are multiple people that wait in the waiting room, make sure your chairs are spaced out. So while they're in the waiting room, how long are they waiting to be seen? Has the patient already filled out their paperwork ahead of time? And where are you? Are you running late? So wait time should be less than 15 minutes. If it's longer than that, you have to figure out why that is. Also, communication is key. So with the patient, you should share your paperwork and needs before their appointment. Either email it to them or put it on your website, tell them to go and fill it out on your website. And if you're a surgeon who's either late or stuck in the OR or you were called to an emergency consult, have your office let the patient know. Even call them, tell them don't come in because the doctor's not going to be available for another 2 hours. It's really not appropriate for patients to come in when the doctor's not available. So patients would much rather reschedule and be happy that they were informed about your being stuck in the OR, for example. Please be sensitive to the patient's needs. Their time is just as valuable as yours. So you may wonder why I got assigned this talk. I actually have a lot of experience with flow mapping and cycle time measurement. I used to work at USC and I worked at this hospital. This is the LA County USC General Hospital. For those of you that watch soap operas, this is the same hospital as General Hospital on ABC. We got an earthquake in California. So This hospital building, which was built in the 1920s, was no longer safe. So they built this newer facility. And this tower here is the outpatient towers. I was in charge of completely redesigning our outpatient system. In a county system with over 800 clinics, I had to take it down to about 140 clinics. And that meant I had to pare everything down and really make sure that we understood which clinics needed what, when, how, and having the patient at the center of this. So we actually had patients, volunteers who were shadowing the patients and walking around with them. And we were able to figure out what the gridlocks were, what the wait times were, where were the bottlenecks, and then use that to optimize our clinic time. We would figure out exactly how many rooms need to be assigned for what clinic, how many attendings and how many residents should be coming to what this other clinic, how many nurses you need for another clinic. All of those were optimized with a really cool system so that we can taper down all these kind of wacky clinics where one person would go to, like, we had some clinic for, I think, Ehlers-Danlos clinic, and there would be maybe 5 patients that come in a month, and they had clinic every week. Like, that made no sense at all. So that's what I'm talking about really tailoring it to your needs. Here's a sample flow, patient flow analysis. The patient walks in. There's a little bit of just the act of walking in, there's a wait. Then you talk to the receptionist, tell them you're arrived. You wait a little bit for the nurse. The nurse then screens you with the vitals. You wait some more. Then the intern sees you. Then the wait some more. The attending sees you, etc. So these are all data points that you can then track and see what the gridlocks and wait times are for each, and then optimize it. Okay, let's talk about your calendar. First of all, are you always late? That's a big problem. Second, what kind of practice do you have? Are you involved in a lot of inpatient care where you have to do hospital rounds? Does the ER call you all the time for consultations? Basically, don't schedule clinic if you can't be there. If you're not a morning person, don't have a 7 or 8 a.m. or even 9 a.m. clinic. Schedule it for later in the afternoon. If you operate, don't have clinic follow your operative time. Do your clinic first and then start your OR day, or I prefer to just have either clinic days or OR days. But if you're much busier, you may want to make it so that your ORs start after your clinic day. What you don't want to do is to be in surgery and now you have bleeding or some complication, you have 10 patients waiting in the office. That's a big no-no because it's not fair for the patients and not fair to the patient that are waiting in the clinic, not fair to the patient that's under anesthesia that you're operating on. I also see doctors that have clinic during their operation schedule. That I don't understand, where they basically have patients waiting in the office. I don't know what they're told, and the surgeon does their surgery. Whenever that finishes, they run to the office and see 1 or 2 patients and run back. That's just chaos, and it makes your office be completely chaotic. That reflects on you. There's no good flow. Your office staff don't really understand how to schedule things. That's horrible flow. When you are scheduling patients in the office, be honest about how much time it really takes you to spend on consults and post-ops, and use that to make blocks of time for consults and post-ops. And never, ever, ever double book. That is just nuts. It's implying that you can be in 2 places at once, which is not possible. All it does is it frustrates people and patients and keeps them waiting. It also makes your office chaotic. So I have a policy where we do not double book. I'd rather stay late and overbook than double book. Lastly, you may have dates where you know you will be gone. It's either a meeting, your kid's birthday, or soccer game, your vacation time. Block that on your calendar. If you don't block it, your office staff will not know and they will schedule patients. And then you have this whole chaos of having to reschedule patients and call. And that just takes away time from your staff workflow. So your staff should not be running around with their head chopped off. They should have a streamlined, low, low, like non-chaotic, low stress work environment where things have a system. The huddle is a good idea, especially if you have a complicated patients, let's say like a bariatric office or a surgical oncologic office. So the system is the week before you sit with your staff to review the patient charts and then look at what you're missing. Do you need imaging or operative reports that you don't have, or a consult from someone that needs to be faxed over? Take care of that. Do you notice that there's a patient with a wound care issue that's scheduled as a post-op, but it's not your typical post-op? You have to do a full wound packing or vac change. That should be changed so that their office visit is allotted a little bit more time. Same if you have a cancer patient, let's say newly diagnosed, maybe you need more time for consultation for that one than for someone who's here as a follow-up. On the day of, you should also take a quick look at your appointment list and make sure you have everything. So for example, someone was supposed to get a CAT scan before they come to see you for their hepatobiliary tumor or mass, we don't know what it is. If they never got their CAT scan, it's kind of a waste of time for you and the patient to show up for this consultation. Either reschedule those or get that done ASAP before the office visit if you have that pull. And if you're missing certain information, figure that out before the patient arrives. Don't waste the patient's time to then be like, oh, we never got the report fax from your doctor. Let's see if we can get that done. That's just a waste of time. That should be done ahead of time before the patient arrives. One more time-saving workflow issue is stocking the rooms. Your room should always have gloves. You shouldn't be running around from room to room looking for gloves, looking for your syringes or bandages or gauze, whatever you need. And every room should be the same, look the same in terms of how things are stocked and what's in it. And that will improve the efficiency of running your office. You may have to actually invest in some things to make your office work more efficiently, and that's totally okay because it will pay off in the long run. For example, maybe you need a good electronic health records that has a patient portal. That way the patient can communicate with you or email you and the doctor and your staff. Forms that need to be filled out can be sent out and filled out through the EMR. If you need to write orders for imaging or labs or prescriptions are filled through the EMR, that's a very efficient way of doing it. The EMR can send out reminders and appointments to your patients, either by text or phone call, automated phone call, or emails. And many also now offer telehealth visits, especially during COVID. For those of you in private practice, I highly recommend you have your own website. You can have all your pre-visit forms uploaded to that website. Information for patients such as where to park, how to get to you, what hours you're open should be on that. And also post-operative educational materials should be standardized and placed on that. In your office, there may be many who are working from home, especially during COVID times. That's okay, but make sure that you have a system where there's some type of shared virtual work environment where patient communications are shared or like memos are shared. In addition to your electronic health records, there are other options like Dropbox or Google Drives that you can use to share work-related information. And I highly recommend, if you haven't already, go fully paperless. I don't have a single paper on any patient. Everything is uploaded online. You know, when the biller calls or the insurance is asking for more medical records, it's easy. And that saves time with my biller. I actually work on an iPad with my patient when I walk in. They get checked in on an iPad, and when I go in, I take notes on my iPad. So it's a fully paperless office. It looks nice and sleek, but more importantly, it helps with the efficiency, especially for access to medical records. You don't have to run around looking for things when your biller, for example, is asking for something. Be very clear when you're assigning work. Your staff should each have a clear idea of their individual responsibilities. I have a separate scheduler, a separate nurse, and a separate office manager and billing person. So also, the patient should know that we have individual staff that do certain things. They should not get mixed messages. So let's say you're scheduling someone for surgery. One person should be calling that patient. You shouldn't have multiple people calling for the same scheduling of surgery. There should be good communication among the staff. Everything should be documented. If a patient calls and says, you know, I can't do surgery for another 3 months, write that down. Spoke with the patient, wants to cancel surgery, may not be ready for another 3 months. And that way, in 3 months, when other things have happened, you have that communication in there. And when you talk with the patient, you know that there's been that communication, and the flow of work will also follow that. And lastly, cross-train your staff so that if one person gets sick or leaves, then everything doesn't fall apart and people don't have to scramble around. It's a smooth transition. If your scheduler needs to get their hip replaced, then your office manager or your nurse can kick in and do the scheduling, and that office flow will not be hindered. And the very last thing is just, you know what? Everyone needs to be happy. Keep your staff happy. A positive work environment will show they won't be overworked or underappreciated, and that will reflect in their work output and in the demeanor they have with your patients. Keep your referring doctors happy. Call them or send them a copy of your note with a plan of care. That will keep them referring you patients, and that should be part of your workflow. And you should set an example. Everything comes from the top. If you're the leader and you're on time, your office will be on time. Don't be late. If by chance you are late or you ran extra with a difficult patient before that, apologize to your patient. And when you sit with them, tell them, you now have my full attention, I am yours. And be very appreciative of your staff's efforts. That's all I have for you. Please follow me on at Hernia Doc, and I'm happy to share any more tidbits if you want. Thank you again to the co-chairs and to Sages for getting this up.